Welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm your host, Rob Hoyle, alongside Chris Kaczewski, my co-host. And today our special guest is Dr. Zenobia Brown. She's the Vice President of Population Health and the Medical Director for Health Solutions. Dr. Brown, thanks so much for joining us. The vaccine is here. Tell us what this means for the impact on public health.
Well, thanks so much for having me. This is an incredibly exciting time. The vaccine is here. And as you said, it is the key to how we're going to get past COVID. Sort of bar none, full stop on that. It is our path to just getting sort of back to whatever this new normal is going to look like. So a lot of exciting kind of information about the vaccine. So I'm just really excited to talk about that today.
Do you want to ballpark when the pandemic ends?
No.
Not to put you on the spot.
So I know there's a lot of exciting information, but there's also a lot of misinformation too. And I think maybe some of the things we can do today is really dispel some of those misnomers.
Yeah. I mean, I think a lot of what people are worrying about is that it all happens so quickly, right? It's like, listen, normally this takes years and years. Is this thing really good? Is it safe? And what I think people really need to understand, every step that we typically take with a vaccine happened for this vaccine. What was different here was that there was international collaboration between labs, and truthfully, a lot of the red tape that does sort of stop things up was sort of eliminated. Also, not for nothing, a lot was invested. There was a lot of monetary investment, understanding that this was that important. There was nothing more important than the health of the American people. So time and money were invested to make sure that all of these labs were resourced to get to the answers that they needed.
Yeah. And there were clinical trials, and thousands of people participated in these clinical trials.
Tens of thousands of people. And I'm like super proud of, obviously Americans, but just people who signed up to be in these clinical trials. They were very careful to get a real sort of a spectrum of our citizens to take the vaccine voluntarily, so that we have representation of race, ethnicity, age. So this vaccine, as I said, tens of thousands of people, and now millions of people have taken this vaccine. So we are, in addition to the trials, the clinical trials that showed efficacy, meaning like that it worked really well, and safety, that it was across, 40,000 people, very safe. Now we have 1 million people plus who've gotten it, and continues to be safe and continues to seem very effective.
Did you get yours?
I've gotten the full series. I am, 2 up, 2 down. And let me tell you, once you get that second one, understanding that this thing is over 90% effective, you have an internal sense of, I am not at the whim of COVID anymore. And we have all been living in this space of just, what if? It's a very hard way to live. And until you sort of have that second shot, you don't even realize how kind of internally afraid of what is going to happen if I get this disease. And when we think across sort of the history of medicine, like this is one of those zones where we've been very good, right? Like we have a lot of information and history on how vaccines work and their safety, and what to look for when they are potentially not safe. And we're not seeing any of that with this vaccine.
With that being said, we do a segment called the Top 3. So from your perspective, what are the top 3 things either preventing us or helping us end this pandemic? So top 1 thing preventing us from sort of doing what we need to do is the internet. No, I'm just kidding. Well said.
It's a great tool, but there is so much false information out there. And especially where you have populations, especially our Black and brown communities that have a legacy of mistrust for healthcare, deservedly so. Whenever you see these kind of reports on the internet around kind of fertility, or the other one is, being injected with things that track you, I've heard this, that is all false. It's basically putting especially vulnerable communities in a position of not having good information and not getting the healthcare they need. But how does that group become empowered to inform their own community? And that is where the information is the most powerful and impactful, is when it's coming from those trusted kind of organizations, whether they be educational institutions. So, we have a whole network of historically Black, colleges and universities, from sort of the religious kind of aspect. So church groups, community-based organizations, so social service organizations that are, highly trusted and regarded in the communities. So I think relying on those institutions that are embedded in the communities, that's where the community is really going to believe the information, as opposed to kind of force feeding, like, this is good for you, do this thing. It really does have to come from a place of trust. The second thing, which I think is so optimistic, is that we have spokespeople out there who are saying, I've gotten this vaccine and I'm saving lives, and this is important for the country, for the world. And like the third thing I'd say, 2021 is the year of the healthcare makeup, right? A lot of what we know now is a lot of people postponed healthcare in 2020 to avoid going to practices. And in 2021, we need to focus on wellness and making sure we're kind of up to date with all those things that are going to keep us healthy.
All right. That's awesome. Well, thank you so much, Dr. Brown, for joining us on 20 Minute Health Talk. To the listeners who tuned in, thank you so much. Stay safe and have a great week.